My name is Dr. Tom San Giovanni. I'm an orthopedic surgeon, foot and ankle specialty, in a sports group in Miami at Baptist Health, South Florida.
Hi, I'm Dr. Tom San Giovanni, demonstrating a double row knotless repair of distal Achilles insertional tendinosis with OSSIOfiber, this new biointegrative, innovative material using their 4.75 Ossio suture anchor. We've already prepped it. I've done a central posterior splitting approach, debrided some of the tendon anteriorly, reflected off the insertion medially and laterally. Tend to usually try to keep a little bit attached. I've then removed the enthesmophyte, and then also there was a haglin. So I've put in one of the proximal rows already, right, to demonstrate. And I'm going to put the second one in. Okay, so this will complete the proximal row. Okay, so here's the implant, right? And you want to place it in the same trajectory, okay? We give it a little tap to try to basically engage that tapered portion of the screw so that it will follow, okay? Once we're in, okay, we stabilize here with this hand, your left hand or your right hand, depending upon what your dominant hand is, and then we twist, and this will advance the screw. So we're stabilizing here, and we're just advancing down until the white portion then engages the cortex of the bone. Through there, you can kind of hear it, okay? Once we got that, then we take the little yo-yo spool, and we just pop that forward so that flies that way. And then the whole thing after that should come straight out, right? So it's very, very user-friendly. You could, if you didn't want the round suture in the beginning, you could actually cut that and just detach it, and that would take the tension off of it. The yo-yo comes with a needle already in it. Yeah. So everything's been kind of thought about ahead of time. And now we're going to basically engage the tendon. We're going to sink this in. I like to have like maybe a good centimeter of tendon there. And I like to space these out a little bit. So you have one a little bit along the medial side and one along the lateral side. Okay, and you do the same on the opposite. Now what you didn't see is like with the bone resection, I really kind of feel everything. I kind of chamfer the edges. I have like a little reciprocating rasp. I don't want any sharp corners, so I kind of really round things out. So now our proximal row is there. We've got that engaged. And we're going to take one from the medial side and one from the lateral side. I'm going to crisscross them. We're going to put these in the middle, I guess, to get them out of the way. So it's going to come down. It's going to come down like that. So let me take these guys. And then these get pulled through. Okay, I like to slide it, right? So we have it, so we're going to put it down. So we got this already, distal row. There we go. Do this one too. Okay, great. And this suture I usually get rid of. Okay. Bring this down like this. All right, that's it. Okay. Yeah, it sounds like it's getting...
right, pull this thing out.
So that comes out. This round suture would take out. You can see very solid repair, and then I'll weave one of these up. So from here I'll kind of go inside out and then outside in, coming through the kind of the midsection of the tendon internally. And the very last one I kind of will come through here. And I do the opposite on this side. And then I'll end with them coming in from the outside in. And I'll tie a knot. So that's that. And then I'll typically leave this a little bit long. Because these like to stand up. And then what I'll do is I'll bury it like that. And then I'll usually take like a running, like a Vicryl or something, a 2.0 Vicryl. And then I run a Vicryl all the way down. That way I've anchored here, and I have also one that's internal, right, that brings these edges together, and I run a Vicryl down like that, and like sit. Very secure.
That's great.
I like it.